As parents, you've probably gotten a lot of questions and maybe a lot of pushback right now about one of our most important preventative measures, and that is social distancing. Okay? Teens and adolescents especially are feeling very angry and frustrated and lonely and bored due to the restrictions we're trying to employ about social distancing. So the first thing I want to recommend is thinking about validating their feelings. It's valid. It's valid and normal for them to feel angry, frustrated, sad, lonely, bored about having to distance themselves, particularly from their peers. We as humans are social beings. During our adolescence, our need for social interactions is at its highest. So it makes sense that kids are going to be frustrated about social distancing. So empathize with them, validate their feelings, acknowledge their concerns. At the same time, we have to provide education to them about why this is a protective measure, why it's globally important for us to do this. Then we're going to get more pushback because adolescents typically use something we call the adolescent fable, which at that stage of development, the brain says, well, nothing bad's ever going to happen to me. And you might hear that. Well, I'm not sick, and my friend's not sick, so why can't we just hang out? That's where we'll have to educate our kids again and remind them, well, just because someone doesn't look sick doesn't mean they're not carrying. And the other piece is, there's some truth to that. Our data are showing us that kids and adolescents and young adults with intact immune systems generally do fine in the unlikely event that they do get the virus. And kids know that. However, we have to talk to them about, while you might do okay, what we're doing is trying to protect those around you and those in the world whose immune systems are compromised and may not do okay if they get this virus. So we want to validate our kids' feelings. We want to empathize with them. We want to remind them about why it's globally important for us to protect others who are more vulnerable than we are. And that can be very difficult. So again, this circles back around to parents. You need to have some stress relievers of your own. So we're going to talk to them about the basics of good hygiene, right? About hand washing for 20 seconds. And actually, it's really fun at home to hear your little one saying happy birthday over and over. And that's something that we can look forward to. It's important to talk to your children about not touching their face. Okay? Things that we need to keep reminding. Basic things like, are we getting enough sleep? Are we eating healthy? Okay? Are we not sharing items? Okay? And one of the other preventative measures that we really need to talk about and reinforce is keeping distance from other people. Hence why we have stopped going to school and why we are socially distancing ourselves from extracurricular activities and things like play dates, which are not a great idea right now. It is very important at this time to establish and maintain routines at home. It is key for us to think about how can our new norm, what we're doing now, be as consistent as our former routines. Okay, so we are establishing a new routine, and this is, in a way, this could and this should parallel as much as possible the normalcy of the routine they were having. Okay, I recognize that this is a big challenge for parents. Many parents are still working, and yet having to figure out, well then how do I also take on the job of the educators right now and think about academics? It is really important for us to establish a consistent routine at home. There are many suggested references out there right now about what routines could look like. So for parents, we might want to set up a loose routine that works for your family. Okay? Balance again. We're going to have to balance the amount of time that we're spending via electronics with the amount of time that we are not spending with electronics. So for example, we want to keep routines the same. Bedtime routines right now are important. Okay? We're going to bed and getting up at the same time that we would on a normal school day. We want to keep our meal routines similar. Okay? We want to balance the amount of time during the day for academic instruction that we have to use technology, but we're also going to want to set up and establish amount of time that we are doing academic work that's non-electronic. Okay? There are great and free sources out there right now too grade level specific, academic, subject specific that you can utilize in order to set these schedules up for your children. We also want to think about how much time are we going to be doing with exercise and extracurricular activities. We'll build that into your routine. If your child went to school and had lunch from 12 to 12:30 and then 12:30 to 1 they had recess, make that a similar routine. Go outside, play. That's okay to do. If on Mondays your child had music class, maybe you could think about in the routine, how do I incorporate some sort of music activity at home, okay? This is similar with extracurricular activities, and this is really where parents are going to have to get creative. If your child is a sports fan and was going to practice Tuesdays and Thursdays for their sport, while they might not be able to go to that avenue or that arena to engage in practice or a game, sure enough, there are probably drills at home that they could be doing at that time. If your child was involved in something like dance, could they use the time to FaceTime with a friend and do their dance routine as they would have on their Monday night dance class? What's really important too is to think about are lessons still available to you. If your child takes piano and your piano teacher is willing to Skype in and do a lesson on Tuesday nights, well then let's keep going with that. So it's important for everyone to establish and maintain routines at this time.